First of all, I would just like to welcome and introduce Manda Scott. She's the Director of HR and Community Leadership Development at Greater Health Now. So welcome, Manda.
Thank you. I'm very glad to connect with this group. Some of you I know from previous work I've done, but I'll introduce myself a little bit, and then I'm really excited to talk to you all about some opportunities to stay in touch with us with some workforce development initiatives and ongoing leadership development and training opportunities. So as at Greater Health Now, we value our partners so much. We want to make sure that you have access to all of our services that we provide, regardless of what specific focus area, project, or program that you're working on with us. So, but my background, I was, again, excited to see this group because this is really my comfort zone. I have spent 20 years in healthcare, starting actually as a CNA in a pediatric unit, which was an outpatient unit for drug-affected babies. So that actually really sparked my interest. I thought I was going to nursing school, ended up with a degree in public health, and ended up in HR after that. So it's been a journey, but my whole career I have focused on healthcare, nonprofit, and social services, just because of that desire to give back to the community. So had a couple of HR leadership roles with Virginia Mason Memorial, some other nonprofits in the Yakima area, and then joined Greater Health Now, actually in June, as the Senior Director of HR and Community Leadership Development. And what I'm excited about this role is that I get to kind of take my past healthcare experience, organization development, leadership coaching, and training, and really work across the region that we serve with all of you. Some that will be new partners for me to work with, which I'm excited to get to know you. And really the idea of working on workforce development, leadership development, and sustainability of some of our key partners and programs that we want to see so that our partners can focus on the great work that you're doing in the community, and we can provide some administrative consulting and training services for you. So that's really what our mission and vision is. So I do HR here at Greater Health Now, but the workforce development and leadership components are really actually the bulk of my work. So from a workforce development perspective, first I will say with our new strategic plan, it's threaded into everything. So workforce, as you know, I could do a quick show of hands of, how many of you have open positions right now? How many of you have positions that might have been open more than 60 days? COVID didn't start workforce issues in healthcare. Those have been ongoing. However, it did exacerbate it, and it created some emergency situations in healthcare. Before I came to Greater Health Now, I was the Chief HR Officer at Kittitas Valley Healthcare and was involved in some state work around some programs, building apprenticeship programs, collaborative with critical access hospitals. And I just became really passionate about that work and how to make workforce programs accessible to people who want to grow their careers in those areas, especially in rural areas where they might not have access to a university or technical college close by. It's a problem that we know exists. It's in mental health, behavioral health, clinics, hospitals. Really, all of our community service organizations struggle with ongoing recruiting, development, prices of labor, salaries, benefits, all of that are just really, really administratively burdensome when you're trying to create retention and engagement with your organization. So first, I will add that about some of our project work around workforce development. We're working on a program called Scrubs Camp. Some of you are actually involved with that, or your organization is, so we appreciate that. We're starting in Yakima because we have some good connections there that are really passionate about this work. Yakima Neighbor Health Services, Multicare, the ESD 105 there in Yakima, YVC, many partners, PNWU, I could go on and on. So do not be offended if you didn't hear your name, but we hope to really work with a lot of different people. But we're starting in Yakima, and it's really a program that's meant to be an opportunity for high school students to learn more about healthcare careers and build up that excitement again. Over the past several years, people have heard about burnout, and those things are real. Healthcare comes with its challenges, but we also want to help people see the rewards in healthcare and the impact that it can have on the community, and sustainable, good paying jobs and benefits in a stable industry that we know has a lot of need. And by stable, I don't necessarily mean in funding and organizational changes and things like that, but it's a need. It's a need that we're always going to have. We're going to need healthcare in one way or another as we work in our communities. So the goal would be to expand that into our 9 different counties and into the whatever work is appropriate for that county, right? If somebody's already doing a great program similarly, we don't really need to recreate the wheel, but we'd love to offer support, staffing for the day, just extra resources, guidance. We're working with our area health education centers, the AHECs that are housed out of community colleges, but really help provide health education resources in the regions as well. So we're going to work with our different communities on that to build up that excitement about getting into healthcare careers as well. We're doing some pilot program work with Triumph Treatment Center right now in Yakima as well, doing some leadership development skills and self-development skills for clients and employees. So we have a program going on right now that we're really looking at the impact of the culture of the organization with some skills training, but then also with clients, do they, with new life skills, life training, does it help them with their next steps in their life and career and getting employment resources as well. So that's been an exciting project to jump into. And we have our learning collaboratives to collaborate with learning as well. With SkillsLine, we're also hoping to find another partner further in different areas of our region, either Benton, Franklin counties, Walla Walla. Another partner actually to expand that work of SkillsLine. So we're excited to kind of look at that and look at our different needs, do some assessment of what would be a good match for that project. And we are also getting together a workforce development committee. So it's an external committee to help guide the work of Greater Health Now based on our strategic plan so that we can hear from people like yourselves that are already connected to our work and want to advise, help us select those different, programs, partners, and make sure that we're really covering our diverse needs in our diverse region. And that we're taking feedback from many, many sources, listening sessions, workforce committees, and conferences. It's a hot topic. It's a hot topic in really every industry right now is recruitment and retention. But we know healthcare, there's a lot of these conversations happening. So how can Greater Health Now take that data and put it to action in short-term projects like we gave some examples of, but also long-term challenges as well. So that's going to be exciting and upcoming as well. So does anybody have any questions just kind of on workforce initiatives, projects, some examples of those, and then I'll talk a little bit more about some training and leadership resources that we have available as well.
Well, Amanda, just to get us talking,
Yeah.
I think what I'll do is just go ahead and go to the next slide.
Perfect. Yeah.
And that'll help some of the conversation perhaps get started so
Okay.
we could have, it's a
Great.
small group of us today where it looks like we're missing a couple of clinics. So that gives us a little more dialogue time. So
Okay, good.
Kim, why don't I start with you and just have you talk to explain to Amanda about where you work and maybe a workforce development need for your workplace. And it doesn't need to be like, sometimes I think our wording sounds kind of fancy and it doesn't make open dialogue, but I know, Kim, we've had conversations about the challenges for you in your rural area. So why don't you go ahead and start us off?
Okay, so my name's Kim Emery and I am a family practice PA. And right now I'm the director of our clinics. We have 2 rural clinics. We have a fee-for-service clinic in Walla Walla and a dental clinic. And we have like a huge population health program and integrated behavioral health. So our current challenge is a dental hygienist. So we did find somebody, we found a locums to help us out. We took, oh my goodness, we probably had locums dentist for over a year. I have a opening now for an MD or DO, and that's been since January. And we do have a recruiting company, but we're in a teeny tiny town in the middle of the wheat fields, and like, who wants to live here? Well, lots of us do, but sometimes it's not who we wanted to live here. We just recently hired a second palliative care nurse, and we have been recruiting for that for 2 years. I have two LICSWs in our integrated behavioral health, and the second one that we just hired a couple months ago lives in New Mexico, and she's tele because after 2+ years, that's, so you're right. We have openings for a very long time. We developed a program to take CNAs and train them to be MARs. So that helped us because in the clinics, we at one time had there's 4 providers here and there's 2 MAs. This is not a sustainable way to do business. So that's been helpful for us. And yes, workforce is a challenge, and we need to still take care of the patients. So
Oh, thank you for sharing. I could not relate more. I'm sorry you're still having to use locum so much. It's I think really what happened, I think people had to survive on these services, but it's really a shame because the wages for professionals turned into like gas prices where whereas private companies could outsource people, and it was really challenging. It's challenging for organizations. So thank you for sharing. I'd love to connect again another time. I'll get your information from
okay.
Laurel too. Yeah.
Thanks, Kim. I know Marcia is in and out. Speaking of, staffing concerns, so she's staffing the clinic there in Pomeroy today.
That is a
So,
real life example of what we're talking about.
Yeah, we talked at the beginning of the meeting, and I promised her, I said, Marcia, I won't call on you unless I have to, because she's like rooming a patient, coming back,
Yeah. Oh,
listening here.
goodness, yeah.
So we'll go on to Michelle.
Sorry, it took me a second to unmute. A little bit of an overview of Yakima Neighborhood Health. Is that what I heard in the list there?
Yeah, just to help Manda know, what's going on there.
Sure. So Yakima Neighborhood Health Services, you mentioned you're already kind of working with us. We have multiple sites. I think we are currently at 10. But Mike, please speak up if I'm not correct on the count. We offer medical, dental, behavioral health services, vision. We also have a variety of support type services, maternity support services, WIC. We have, I think 14 community health workers right now. That may have changed recently. We have outreach staff, supported employment, supportive housing services, care coordination, a wide variety of services. We as well have been having to rely on locums for our medical services, primary care, mostly, I guess I would say mostly leaning towards the adult services as opposed to the pediatric. And that has been going on really since the pandemic. We have historically had a difficult time with filling behavioral health positions, but recently, for whatever reason, that seems to have changed, and we are getting qualified behavioral health candidates applying, and we're able to fill more roles. We always have openings for like medical assistants, community health workers, case managers, those sorts of things. Like it seems to be, cycling through that way fairly often.
That's wonderful. I'm glad to hear you're getting some traction. Anything that you think, just to be able to help everybody, that helped you get more traction with candidates coming your way, or nothing specific that comes to mind?
Well, our CEO has been very active with the state in looking at regulations around behavioral health providers and trying to address the the behavioral health provider shortage across the state. So she's been, working on those sorts of things. We have also been able to offer through some grant opportunities, scholarships to kind of grow our own, staff that maybe had a bachelor's in
Yeah.
a related field could get their master's through this process. So that certainly has been one of the, the areas that has helped. We've got one individual that just came on in August, finished her master's and is now an associate LICSW and is working on getting her hours now to be fully licensed.
Great.
Yeah,
That's
so that
wonderful.
I think has helped.
Yeah, you guys are doing some really great things. I got to attend your health fair earlier in the year, and so that's great. Michelle, remind me what your role at Yakima Neighborhood is.
I'm the Chief Quality and Compliance Officer.
Oh, great. Okay. Excellent. Yeah.
I'm also a licensed mental health counselor.
Great. Well, nice to meet you. Yes, we appreciate our partnership with you guys very much, and so I appreciate meeting you, and look forward to hearing more.
Oh, thanks. Mike, is there anything you would add?
No, I think you covered it all.
Okay.
And hello, Mike. Mike and I used to work together previously as well in Yakima, so nice to see you again. Yeah.
Yeah.
Okay, and then it looks like Stacy was on, Stacy George, and then she's off. So I just want to say, is there anything that you want to share with Amanda about a workforce development request, or what you wish you had if there was something offered by, sponsored by Greater Health Now? If that anything comes to mind?
Is that to me, Laurel?
To everyone,
Oh,
including you, Michelle. There's just the staff, I'm sure. He's like, can you just bring us people? So Amanda, I'll go back to you and let you share the rest of what you had to share with us.
Perfect. Thank you. Well, we look forward to more input from meetings like this. So I'd love to stay connected as we get some data from some of our programs, things like that. Laurel, keep me in mind. I'd love to pop back in, and I'd love to get all of your contact information too, just in case I'm out and about and in your neighborhood in the region. I just moved to Kennewick. So I was in Yakima 13 years and worked in Kittitas Valley. So I'm out and about in your different areas, and would love to grab a cup of coffee and hear more, because it takes a team, that's for sure. And there's some progress being made in the critical access hospital world. When I was leaving, there was actually, a group that was going to kind of take control back from the kind of short-term locum staffing and do some staffing agency work from the hospitals themselves. So I'm hoping to see something more like that. That's kind of the thing that Greater Health Now is hoping to build, is not specifically staffing agencies, but how can we help our partners and come together to provide more resources to people, because it's just really hard to sustain that when you're trying to chip away at it without a team and a network. So yeah, I look forward to staying connected. And then I think you had a slide, Laurel, that had like where to find our training opportunities. That was nice. If you want to go back, otherwise I can share my screen.
Why don't you go ahead and share,
Okay.
if you don't mind?
Yeah, I can show you where on our website to go here. Let's see here. Share. So all of our opportunities are on our website under events, and you can actually find some really great, credible training that myself or Amber Henderson, our Chief of Strategy and Excellence Officer, facilitates. So kind of switching to the leadership side, leadership development, leadership coaching. If you guys ever just have an HR question, some of you have really great, I think, HR resources internally in your own organizations, but if you are like, just needing additional support, resource guidance, feel free to contact me anytime. Laurel, make sure you have my information as well. We,
Okay.
again, just want to be able to support our organizations, and again, kind of just create this network. And we believe in kind of leadership development tools to help with that retention side, supporting your culture, kind of effective leadership and sustainability of organizations. So you have our learning collaboratives here. Hopefully you can all see this. It looks like you can, so that's good. You can see all of our list of our ongoing learning collaboratives, which some of you participate in and I believe you have access to, but you might not know about our training and team development. So this is kind of more of that HR and organization development. So if you click on our list, you'll see our opportunities, and boy, the ones that are upcoming have filled up. So they've been very popular. So, but I want you to know how to sign up. And what I will also say is we can do organization specific training if we kind of plan ahead, budget for it, make sure we have enough resources. We might ask to have some shared, like, hey, if you can get the facility costs, we might get the materials, that kind of thing, but still in a much cheaper way than if you were to do some of these yourself. I mean, Crucial Conversations, I've been certified in that since 2016. If you were to just like go purchase it as an organization, it's like $300 a person sometimes to be able to just get the materials. But so we are really proud to be able to offer these really, really well-known, credible trainings in a group that help us provide those resources to the community, build that network partnership so that we can have more conversations as well. So Crucial Influence, Crucial Conversations, those are from the Crucial Learning platform. Some of you have maybe participated in those before, but really about leadership and communication. Crucial Conversations and is good for anybody. It's a good class for anybody, but specifically leaders find a lot of value in it as well. Just having difficult conversations, getting to the heart of the matter, and helping with some tools and language to start those conversations that feel like conflicts. Civil Treatment for Leaders is a employment law training, but I promise you it's more fun than it sounds. It's actually very interactive, case studies. You get to be the jury in certain situations, and you get to kind of see some of those really, really just time-consuming, high-risk things that happen in organizations from a leadership and HR perspective. You get to kind of see how to navigate that so that you can kind of reduce risk and kind of protect your culture as a leader. Leadership coaching, again, this is something kind of on an as-needed basis. We can't obviously do this for a high volume amount of people, but if you have like, for example, I've had an organization have a new executive director, and they said, you know what, we have our top candidate, but we don't feel comfortable, necessarily hiring them into this role without additional resources because it's a huge job. It's a new job, a new area of opportunity. So could you help them perhaps with some getting through the transition stage, getting their leadership up and running, and with some additional tools? So that's the kind of thing that we can do to kind of help organizations with just kind of culture and development. So we'll have more to add to this plate. Amber's getting certified in a couple other things. And again, these are filling up, but if you're trying to get into a class and it's full, but you have kind of a group that maybe you think would be benefited from it, reach out to me with that contact information, and we can talk and kind of hear more about your needs for the future in 2025 as well. And we're also, again, one of the other goals of providing these trainings is we keep the sign-in sheets, we keep you in our system, we get you on our information list, and we are working towards building a consortium of our community-based organizations from the business perspective to support HR business infrastructure needs. So that's kind of what we're working towards in the future. And this is all kind of helping provide the foundation for that so that we can know what people's needs and interests are. So very exciting
Amanda,
stuff.
just to circle back around, so what's the cost associated with
Oh
attending?
gosh, these are free. These are free for you. If you can get into them, they are free. When you see them on our site and you can go into the events, I'll show you. That's why I just really encourage people to take advantage of these and think ahead. Because when I first came on board, I thought, I know the cost of trainings because I've bought them myself and taught them myself, and it is just an incredible benefit that we're providing. We do post these public sometimes, but our priority is you guys, our partners. So we will, when we have these, that's why we like to come to meetings like this to get you access, because we know they fill up, and our priority really is doing it with our community-based organizations. And we're working on our 2025 calendar as well, so that will be up shortly. But yeah, anything on here is free for you when it's on the training and development, or it will say if there's a cost in the future. I can't commit the organization to always providing everything for free, but as we're rolling out these programs and getting resources for people, right now they're free when you sign up. You'll see if you all let me just click. So I'll show you civil treatment for leaders, which we'll be teaching next week. You'll see it's all through the event, Sign Up Genius. Oh, I think I'm clicking the wrong screen here. There we go. Free admission. There you go. Reserve a spot.
Yeah, I think I saw that initially when you told me about these and I was like, can't be. And
I
so
know.
I went
know.
back again and you said it again. So that's why I asked you to repeat that for those of us who are attending, because
Yeah.
you know, it's so good to, even if you can just get a couple of people to go from an organization, it really can help
Yep.
to get
Yep.
some of this training. It's hard. I mean, leadership training from my experience is something that I wish I had more of when I was in a
Mhm.
leadership position. So, you know, to just get away and have thoughts about these things is really important, and that it would be free to your organization. It is such a good service that Greater Health Now is providing. So, and then you did talk about like specific things. So if people had like someone from Columbia County or someone from Yakima neighborhood or those on the call, if they have something going on in their organization, like a whole huge redo or something,
Yeah.
could they reach out to you about potential
Absolutely.
assistance?
Absolutely. In fact, I've had people, you know, from some of the organizations I think that are even on the call that have asked for things before, knowing that I am certified in some of this stuff. And I'm like, "Oh, I really can't," because I was in a position where I wasn't doing a lot of training. And that's really why I joined Greater Health Now. I love teaching. You know, there's other reasons too, but when I found out we're doing these trainings, I probably asked 5 times, really? We can provide this for free to people? And it's so exciting. So
Yeah.
now I can. So if you're going through something and it's a specific initiative, what you do, you just talk to me. I can just work on, you know, what would the cost be to us, make sure we have something in our budget for workforce, work with my leader, see if we can provide something. We might come back again and say, okay, shoot, maybe we can split the materials or something if it's organization specific, and not a broader thing that we're inviting multiple partners to. But it's worth talking about if you guys have needs, definitely.
I know one of the things that you've talked about is that transition time for organizations,
Yeah.
and
Yeah.
everyone on the call are there been transitioning is with this work that we're doing with
Oh, yeah.
primary care transformation. And so what is that type of training that we
Oh,
have?
you know, I wonder, Laurel, I would be even happy to come and do a little overview for this group at one of your meetings. We can talk offline if you think that's fitting or appropriate for this group, but it's Managing Transitions. You can get the book on Amazon, and it's from William Bridges, and it's about organizational change and transition. But unlike a process improvement lean initiative, you know, that many of you probably have training on in healthcare, it's really more about the psychology of change and what people need during change to progress. And it focuses on communication, leadership, where identifying where are people stuck, where are people at in the process, and how do you coach them along through that. So again, the book is Managing Transitions by William Bridges. If you are interested in that for your organization for cheap, you can always do a little book club or something, but I'd also be happy to come and kind of show the model and see if there's something that would resonate. That might be a good idea. And then if you wanted a deeper dive, we could talk about how to do that too.
Okay. All right. Thank you, Amanda. Does
Yeah.
anybody have any specific questions or comments that you want to share? All right.
Thank you. I'm going to hop
Thanks
back to
for
another meeting,
joining.
but I
Yeah.
enjoyed listening. Thank you. Bye.
Yeah. Thank you, Amanda. Bye-bye. Okay. Yeah, I just wanted to have the chance to share that information with you, and I've been getting a clearer picture on some of the things going on at Greater Health Now. So I hope you guys, we can talk about it at our individual meetings, but let me know what your interest is and we'll follow up with Amanda. Okay, so I'm going to go ahead and share my screen, and I wanted to talk a little bit today with the time that we have left about health literacy. So there's a couple of definitions here on my PowerPoint. I know you guys are quite familiar, so but I wanted to, when we talk about, sorry, get through that. health literacy, I know this 9th accountability has been somewhat of a challenge because we're like, well, how do we do that? So I wanted to try and answer that question to the group. So this is a snip of that accountability, health literacy. And so the standards are up top, and that's readable at 8th grade reading level. Patient-facing forms are to be readable at 8th grade reading level and available in languages that reflect the patient population. And then accessible formats, so Braille, large print, or audio, and then using inclusive, non-stigmatizing language, reaffirming confidentiality of information. So level 1, 2, and 3, when you look at that, so, it's the beginning is in level 1, and then adding a little more consistency to it in level 2, and then all standards are being met and are available in all accessible formats. So I wanted to just reiterate like that 9th accountability. I know some of us, that are trying to get up to the next level, there's some points for demonstrating competency in that. And so I wanted to give you some tools to try to do that. And one of the first things I want to do is have you guys grab a quick sheet of paper, something to write on. So you're going to have 18 words that you're going to write down as we go through the next few slides. So grab that, and then I'll give you the explanation. So this is a health literacy assessment tool that can be used just to see how our patients, what their level of literacy is. It's pretty quick. I know that, it can't really be done as part of a patient visit because there's just not enough time. But what I wanted to do is help expand our minds to think, because as we think about health literacy, so I think it's easy to think, oh, they got that. We forget as being people that are working in healthcare what our level of knowledge was when we weren't working in healthcare. So when you're doing this, using this tool, you would in person, you would say the word, you'd speak the word kidney, and then you'd have the person say the word, you'd show it to them, and then they would say it, and then you would then know if they could read it. And then you say urine or fever. So that would be the word that's most closely similar. And it doesn't really, you don't really say why, but so it's a quick thing. So what I'm going to do is just go through we're going to go through 18 slides quickly. And I will say the word, and then you guys just write down which word you think is most similar to it. Any questions? You guys really going to do it? I know you're at your desk.
Yes, we are.
I made myself do it. I was surprised. Okay, so that's the first one. So you just write down which word. Number 2, occupation. Medication. Nutrition. Miscarriage. Infection. Alcoholism. Pregnancy. Seizure. Dose. Hormones. Abnormal. Directed. Nerves. Constipation. Diagnosis. Hemorrhoids. Syphilis. Okay, so the next slide is going to be the answers to the first 9. So the word, if you have the same word down, you'll count that as 1 when we score it. So this is the first 9. Are you guys ready? Okay, I'm going to go ahead and switch. And that's the second. Okay, so for this tool, it's 0 to 14 correct answers, suggests low health literacy. So, so if you missed, more than 4, then you have low health literacy. And it's kind of surprising because this is it's a evidence-based tool that's been used. It's from the Agency for Healthcare Research and Quality. I've given you the citation in the corner, but it's so interesting to think that someone who has, less than 14 on that simple test would struggle with most patient education materials and will not be offended with low literacy materials. So that's just, I just think that's really interesting. Something to think about and to open our minds to our language. And I have some other stuff here to go through, but going on the AHRQ site is pretty helpful. That's they have a few tools. They have a short 7-word one, and they have a longer 15-word one. This one was 18 to check on health literacy and a scaling for that. It even has like, make this shrink somehow. I wanted to be able to share my screen with you to show you some of the resources that I found. But the AHRQ has some tools, more than one, and a whole kit about health literacy and how to improve the documents that patient-facing documents that you have, to improve them so that they're in more plain language for your patients when they're reading them. One of the first steps in there, they have a kit, more or less, and I'll share my screen here in a second, to train staff members. So you start with training one person, and then you go on to train, and then you go on to from there to do the different steps. So sorry, just stop sharing for a bit. And okay, so what I wanted to do is just show you some of these resources. Okay, so first of all, I started off with a safety net medical home initiative. So patient-centered interactions in the guide on patient-centered interactions. That's where I got started with some of the resources. And these links are included in the PowerPoint, which you'll be able to get. So this first one is the AHRQ, the health literacy measurement tools. So these are the ones that that's the first one I was just showing you, the rapid assessment of literacy in English, and they also have them in Spanish. And then there's information about how to score them and what that means on that website. So also on the AHRQ website are, this is a publication, the Patient Education Materials Assessment Tool and User's Guide. So this is pretty practical. It does have step-by-step, like what do you do? Here's, just simple, like how you should or should not use numbers, word choice and style, and some of that is in more than one of these references that I'm giving to you. But so it just helps us, especially your providers, to help them know, okay, don't say excess mucus, say runny nose, you know, some of those hints, but to look for those in your publications and find them. This is another one called the HEMAT, or Health Education Materials Assessment Tool. This one I thought was pretty easy if you wanted to use it for this Accountability 9 and pull up some of your patient-facing, one or two, you know, for reporting. Just pull them up and then go through these questions and answer them, and you'll have a good idea if your material is for people that have lower literacy. The material has an obvious message near the top. Think of the main message as the most important thing for the audience to remember after reading the material. You need to be able to tell at a glance what the main message is. So this one is a pretty yes or no and notes on it for your organization. It'd probably be nice to have, you know, a couple of you at least look at it and go through these questions. And it would be very helpful to know, you know, okay, this is important for me to redo, you know, lots of the things that we do know, you know, having lots of space, using a large font, also using bold or things like that. And then as well as assessing the language in there. So that's another one. And then this was an article. I'll go back to the PowerPoint after I get through all these. And this was very interesting, the way that this article offered some helpful tools about how to specifically find out what grade level your document is. So they call it SMOG, Simple Measure of Gobbledygook. I like the name. So there's 30, you look at 30 sentences to assess the document, 10 at the beginning, 10 in the middle, and 10 at the end. You count the number of words with 3 or more syllables. You use a table, which is available in this document, to identify the reading grade level based on the count. And you use a conversion formula to assess documents having grade less than 30 sentences. So, you know, some of this was really good. Some of their findings were very helpful. This was just some examples of, you know, different words to use instead of the longer syllable words, instead of activities, tasks, instead of are depend upon, you know, some helpful hints for us as we go through documents to make them easier to read. So that's that one. So good articles. And then CMS has some guidelines for effective writing. And where I see this helpful too is so much of our learning and writing educational resources are online. So if we're creating things like for patients to check in via your health record or via portal, that if you're creating a document or creating a screen for that, a web page or something, these are just really helpful hints on what to do and what not to do. The importance of using an active voice. So you would say Medicare covers the wheelchair, not the wheelchair is covered by Medicare. So we want to, like, as recommended in several of these resources, to use the active voice. And then it talks about avoiding languages to avoid. And, you know, again, some of that, don't say assist, say help, commence, say begin or start, you know, consequently. So it just kind of helps us go through the document and find these things and then replace them, helps us know how to replace them. Let's see, what else do I have? This one I thought was very interesting. It's for health literacy for online. And it has really step-by-step specific things to do or to be aware of as you go through documents or create documents for online. And it's by the Office of Disease Prevention and Health Promotion. So I thought this one was also very well done. So I'm gonna go back to my PowerPoint for a minute, but have any of you used any of those resources that I just shared with you?
I have not.
Okay. Kim, have you seen those?
I saw those from some of the information you gave me, but to be honest, I have not had time to dig around in them.
Okay. And that's kind of what I was hoping to do for you is like, okay, show them to you. And then if you wanted to
Yeah.
work on that accountability to go ahead and at least you'd know kind of which one. So when I will email out the PowerPoint to you. But I have all the links in the PowerPoint so that you can refer to them. So those are the SMOG, the KeyMat, and that kit, the whole assessment toolkit. I showed you that, and that. What I didn't show you was, let me go to start. Okay, so this was interesting. This is a gaze path of a reader who does not have limited skills. So this is, looking at, they were watching someone on a screen watching, and so that's the gaze path. And there's the gaze path of a reader who has limited literacy skills. So very different. The first one, not limited literacy skills. The second one, a lot different. So when navigating a website, users with limited literacy skill tend to get distracted by extra words and elements of a website, like links and icons. Okay, and I was preparing this, and I was like, okay, I do a lot of these things. So I think some of them are skills we've developed by having too much information available to us all the time. But the second one is navigate in a linear fashion and backtrack frequently. Choose the first answer they find without checking if it's correct, and have a hard time telling the difference between high and low quality information. So that brings to mind the internet, right? Of like, this is the fact, and I'm sure, patients being seen, this is something that comes up all the time. Having trouble recovering from mistakes. And so there's, it's that the last or next to last reference citing on the internet that I gave you that tells you how to make your online documents or forms or anything so that they're easier and the patient is more equipped to make healthcare decisions, because that's really what we're trying to do with providing all this information. But also, if you think about forms, that they get completed appropriately, that they understand what information you're looking for when they're completing forms. And so I just wanted to circle back around and talk about accountability 9, health literacy, and patient-facing forms and information are readable at an 8th grade reading level and available in languages. So I think everybody has a good handle on what languages they serve in their patient population. But it's this 8th grade reading level. So what I'm saying is using some tool to at least go through and check your document to see if it's at, what reading level it's at, or if it's as simple as possible. Then just put in your narrative that you did that process, and then upload the document that you evaluated or assessed, and then you can get credit for this health literacy accountability. So with that, we just have a few minutes. Do you guys have any comments or questions about those things? And then it's being recorded, so this our webinar. So if you have any other questions or concerns, we can go over it during our meeting, or the recording will be available on the Greater Health website. And then just a quick reminder from me that the deadline for completion of reporting is October 31st. And next month's shared learning webinar is not going to be the 4th Thursday because that's Thanksgiving. So we'll plan on the 21st at 1 p.m. and I will get an invite out to you. I do not have an invite out to you for November or December, but I'll have that as the third Thursday instead of the fourth, so I'll get the invite out soon. All right. Well, it was good to have you online. Thank you for getting here today, and I look forward to talking to you soon. Bye-bye.
Thanks, Laurel.
Hi, everybody.
I